Turning down the pain volume, fibromyalgia. See how symptoms can cause future issues along with treatment options. What is fibromyalgia? Fibromyalgia is a long-term condition that causes widespread body pain and tenderness throughout the body. Fibromyalgia often affects the muscles and soft tissue. The pain happens along with fatigue. It also can include problems with sleep, memory, and mood. Fibromyalgia is proven to affect the ways the brain and spinal cord process painful and non-painful signals. Fibromyalgia is approximated to affect about 5 million U.S. adults. Symptoms of fibromyalgia that you should pay attention to: widespread pain, fatigue, sleeping issues, memory loss, headaches, jaw or facial pain, irritable bowel syndrome, sensitivity to touch, light or temperature, anxiety, or depression. These are some commonly known symptoms of fibromyalgia. If these symptoms interfere with daily life, it is recommended to discuss the matter with your doctor to get a proper diagnosis. What struggles can these symptoms cause for someone with fibromyalgia? Walking, driving, cleaning, hygiene, getting dressed, cooking, sleeping, communicating. Widespread body pain, fatigue, sensory issues, memory issues, and more can make these tasks very difficult to complete for people with fibromyalgia. Lacking or avoiding these tasks can cause further problems, including societal impacts in the future. How can fibromyalgia hurt in the future? Economic impacts, including increased healthcare usage, reduced income, and higher unemployment rates. Societal impacts include problems with personal relationships, social isolation, reduced daily activities, avoidance or reduced physical activity, or loss of career. Ethical impacts include being depicted as hysterical, deceitful, untrustworthy, or dangerous among people who do not have fibromyalgia, accepting of negative judgments or statements about themselves, discrimination in areas including housing, employment, healthcare, and more. Risk factors that can increase causes of fibromyalgia: family history of fibromyalgia, not being physically active, history of emotional or physical abuse, or being biologically female. How is fibromyalgia detected? 7 or more on the widespread pain index, or a 5 or more for the symptom severity scale, or scores of 3 to 6 on the widespread pain index, and a 9 or more on the symptom severity scale. The patient's symptoms and pain level must last 3 or more months. The patient must not have another disorder that can cause or explain their symptoms. The doctor will then examine the patient furthermore, focusing on their health history, additional symptoms, perform physical exams, assess for alternative diagnosis, and other options. If the patient fits the fibromyalgia criteria more, the doctor will create a therapeutic alliance, educates, and starts working towards treatment to assist the patient towards the help they need. If the patient does not have fibromyalgia, the patient can be considered for another disorder that can better explain their symptoms. Common treatment options available for fibromyalgia: exercise, including low-impact aerobic exercise. Strength training can improve muscle strength, flexibility, sleep, mood, and more. Medication, including antidepressants, anti-seizure medicine, analgesics, can be prescribed to improve sleep and relieve pain. Cognitive behavioral therapy, including one-on-one counseling or group counseling, changes the way how the patient views or deals with pain. Who can treat fibromyalgia? Primary care providers, rheumatologists, physical therapists, exercise physiologists, sleep specialists, and mental health professionals. Treatment for fibromyalgia often needs a team or group of people that can help with recovery. Depending on what issues weigh the patient down the most, some doctors may be needed for treatment while others may be less prioritized or not be used entirely.